Hi, my name is Sammy Schwartz, and while my original patient got discharged today, I'll be talking about my last-minute switch to patient GB. Until recently, GB has resided in Ann Arbor, Michigan. He's a 64-year-old male who's single and Caucasian. His usual occupation is Cambridge Digital, but currently he is unemployed. His usual source of medical care is East Ann Arbor Health and Geriatric Center, and his primary physician is Nancy B. Stryer. On the day that I visited him, his blood pressure was 119/55, his pulse was 38 beats per minute, and his respiration was 26 breaths per minute. His primary reason for seeking care at Heartland was his acute cerebrovascular accident due to an ischemia in the left coronal radius, which occurred on September 11, 2013, where he was then admitted to U of M Hospital. Currently, he is working to gain back independence and adjusting to losses he won't get back. His secondary reason for seeking care at Heartland is his neurogenic bladder, which is related to a spinal cord incident he had when he was 17. This incomplete C7 spinal cord injury was from a diving board accident and has left him paraplegic and has given him spasticity in his hands, and so he can't open them. He also has, because of this, he has a loss in sensation below his waist, and then after his stroke, this escalated to below the nipple line. Additionally, he experiences some hypertension and atrial fibrillation and some significant fluctuations in blood pressure. For example, sometimes they're 160/70 and sometimes they're 224/110. While he does experience some anxiety and depression, he explains his overall general health as pretty good. As far as his health history, the only major thing he had was that spinal cord injury at age 17. And as far as immunizations go, he doesn't remember them, and they're not in the charts, so I'm not sure on those. For allergies, he did claim that he was lactose intolerant, and from the charts I was able to gather that he's currently on medication for hypertension, the spasticity in his hand, the neurogenic bladder, his anxiety, impression, and insomnia. For his health habits, he does not claim to be doing any drugs or alcohol. For his exercise, he claims he gets it mostly from his activities of daily living, such as getting in and out of his power chair and driving, although since his stroke, he is not experiencing as many of these activities of daily living. As far as rest goes, he claims he's getting a regular sleep schedule, about 4 to 5 hours of sleep at night, but you can tell that he's still experiencing some sleep difficulties due to his medication for insomnia. For his nutrition, he does notice some taste bud changes, which could be related to his aging since he's 67, but luckily he explains that he's eating regularly, which may have to do with the fact that he's in Heartland. He claims he sometimes smokes, but again, I think this is decreased since he has been in Heartland. As far as caffeine uses, he's not currently having too much caffeine, although he did claim that he used to drink a lot of Pepsi and tea, which both have a lot of caffeine in them. He does claim to always wear a seatbelt, and as far as his family dynamics goes, his parents passed away, and he has 3 older sisters, one of which seems to be playing a particular role in his life by being very supportive and always being there, always visiting him, and she's also listed as his emergency contact. As far as his interpersonal relationships goes, before moving to Heartland, he did have 2 roommates, where he lived independently in Ann Arbor. For his perceived stressors, he is mostly concerned about going from independent to pretty dependent, since he has a very high lack of mobility. For his environmental hazards, while his location doesn't really serve as a problem because he is in the safe neighborhood of Ann Arbor, his dependence on other people poses as a big problem if he were to go back home, because if there was a gas leak or a fire, he would need help to get out. Additionally, if he were to go home, he claims that his caregivers are pretty incompetent, which receives as an environmental hazard, which is a big reason why he has agreed to his long-term stay at Heartland. As far as his culture and spiritual practice goes, he claims they're not a big part of his life, and for his educational level, he has an associate's degree in computer science. For his healthcare, for his stroke, he was admitted to U of M Hospital, And when he returned home and his symptoms seemed to worsen. For example, he was lethargic, he had confusion and some dysarthria. After he went home on September 17th, 19th, he went back to U of M hospital. And then when he was discharged after that, he had some trouble sleeping, and his appetite and energy were very diminished. So his sister thought it would be best if he went back to Heartland, and because he thought that his home aide was incompetent, he agreed to go along with this. For his family history, his dad died in 1974 at age 66 from stroke complications, and he admitted that he has some problems with drug and alcohol abuse. But he also mentioned that he does not know too much about his dad's side. He also didn't mention too much about his mom's side, but he did mention that she died in 1976 from ovarian cancer. For his assessments, I chose to do musculoskeletal as one because of his possible muscle and joint pain from his possible overuse of muscles because he is paraplegic. He's going to have to compensate for the muscles he can't use. And also, since he just had a stroke, I want to know if there's any changes in his musculoskeletal system. And the second assessment I decided to do was neuro, and chose this because of his spinal cord injury, and I want to see if there's any possible nerve pain, which is especially common in patients with impartial spinal cord injuries. And also his depression, I wanted to see just how far along that was, and to see if there's how serious that was. I also chose neuro because of his recent stroke, because I want to know how his talking and swallowing is, and I want to know if he has memory loss or difficulty concentrating or any other emotional problems besides his anxiety and depression. When I did a review of the systems on his nervous system, he did claim that below his chest he had some numbness and tingling, and also additionally on his right shoulder, which was an onset after his stroke. He did not claim to have any past history of seizures, but he did say that he has some troubles with concentrating in his memory occasionally. As far as insomnia goes, he said not really, but he is on medication for that, so we know there are some problems with his sleeping. He had some unsteadiness and loss of balance in the sense that he's paraplegic, in addition because he can't use his hands, so he's unable, for example, to hold a cup. It's very difficult for him to grasp onto that properly. As far as his anxiety, I do think it interferes with his daily activities because he claims that he does feel like he could drive, but it doesn't feel comfortable with it anymore. And then additionally, the fact that he's at Harland and not at home he feels scared to be alone in case something were to happen to him, like a gas fire or gas leak. As he did have some difficulties with speech. Again, he had dysarthria right after his stroke, but it went away a little bit. Besides his stroke, he has no history of head injuries. Head injuries. As far as his musculoskeletal system goes, he does claim there's some swelling and joint pain in his shoulder, his right shoulder, and his right shoulder. Which occurred to him after the stroke, and he also mentioned something about his wearing his cuff down low. Additionally, he also mentioned that he has some edema in his legs. And as far as his range of motion goes, it is severely limited because of his paraplegic state, and his movement of his right arm is decreased significantly because after the stroke, and he can't open his hands, which does pose as another limitation to his range of motion. His daily livings are also very limited because of this lack of motion and him being bedbound. And he does have some residual weakness throughout most of his body, but he does not claim to have any history of arthritis. When I went to physically examine him for his neuro state, he scored perfectly on his mini mental exam. He was oriented to place, time, and self, so orientation times 3. He was able to repeat the 3, and have an immediate repeat of 3 objects, and he was able to repeat them then and later, and then also identify 3 objects. and he was able to count down from 100. He was able to repeat no ifs, ands, or buts. He was able to follow a 3-stage command and read and obey the closure of eyes sign. He was able to write a complete sentence and copy the design down, but it was slightly wiggly. And his level of consciousness was alert. His eyes were opening. When I walked in, he was verbally responsive, and also with what movement he was able to move his body accordingly to turn off the TV in order to look at me. As far as his general function, he's bedbound, so I was not able to assess his gait or heel-to-toe walk, or additionally perform a Romberg test. As far as his upper extremity and fine motor, he was able to perform some of these, but only in his left arm. He was able to do finger to nose and my finger to nose and do some rapid alternating movement, but he was not able to perform this on his right arm. His lower extremities and fine motor were impaired because of his spinal cord injury. He was not able to do, for example, heel to shin. He did have light tense sensation and painful sensation. He was able to detect those, but only on the upper part of his body. We were not able to assess the vibratory sensation because we did not have a tuning fork. As far as his cortical and discriminatory sensation goes, he did have stereognosis and graphesthesia and proprioception. As far as his pathological reflexes, I was not able to assess those because he's paraplegic, but if he wasn't, I could go ahead and test the Babinski and ankle colonus. For musculoskeletal, he was able to have a lot of upper body movements. For example, his TMJ, he was able to retract and retract, right and left lateral rotation. He was able to open and close it. His neck, he was able to flex, extend, hyperextend, right-left lateral movement, right and left rotation. And his shoulders, this is only on his left side that he was able to flex, extend, hyperextend, abduct, and adduct, internal, external rotation, and circumduction. Although for his right arm, right shoulder, he was able to get a little bit of abduction and adduction. As far as his elbow, he was able to flex, extend, but he was not able to hyperextend, and he was able to supinate and pronate, but this was only on his left side. As far as his wrist, he was able to flex, extend, and hyperextend, invert, evert, and circumduct. Fingers, spine, hip, knees, and ankle and toes were all unable to be assessed because he is paraplegic. As far as his muscle strength goes, his deltoids scored a 5, and his biceps scored a 4. His triceps scored a 5. His wrist strength, while he couldn't open his hands, he did still score a 5 on wrist strength. So I was not able to assess finger strength or hip strength or leg strength with hamstrings or quadriceps, or ankle strength. I was not able to assess that. If I had to choose 2 more assessments, I would choose, one of the assessments I would do would be integument, and I would want to check, my main concern would be pressure ulcers. For example, according to Oli et al. In Mayo Clinic, because of his immobility and his friction, which would be due to him being in bed and having to get someone to help him move in and out and shear, because he is bedbound, that bed, when it goes from sitting to laying position, it's going to rub against his back in opposite directions. All those signs, again, according to Mayo Clinic and Oli et al., are going to increase his chance for a pressure ulcer. Additionally, they also claimed his poor blood flow from not moving and his spinal cord injury and his age are going to have an impact and give him a greater chance of pressure ulcers. And additionally, his loss of sensory perception below the waist makes me concerned about any injuries he's unaware of, and his depression makes me want to check for any self-mutilation such as cutting. As far as the second assessment I would choose would be peripheral vascular, and I would want to check for any peripheral vascular disease such as a deep vein thrombosis, because according to Mizamzi et al. In Mayo Clinic, because of he has an increased chance for several things, including the fact that he's a paraplegic, so he's going to have that prolonged bedboundness and his lack of blood, which is going to cause a lack of blood circulation due to improper muscle contractions. His recent stroke would make me want to check for any more possible blood clots, because as a side effect of peripheral vascular disease is stroke, so there's a good chance he already has a problem with peripheral vascularness. And because his dad died of a stroke, it's clear that there's a family history of strokes, which could be, and he could have inherited blood clotting disorder, making it easier for his blood to clot, or maybe even poor blood vessels. His hypertension and the fact that he's over the age of 60 and his atrial fibrillation, which makes it so his heart can't pump as effectively, also increase his chance of a deep vein thrombosis. And those are the assessments I would do. Thank you.